Hello, my name is Kevin Ohlendorf, and I'm the president of the Ohlendorf Appliance Laboratory. This video is part 2 of our series on the SASSOUNI Plus analysis. This part will discuss the maxilla and the mandible and how they relate to each other and the patient as well. SASSOUNI Plus is the only analysis that allows you to evaluate the length of the maxilla and the mandible anteriorly and posteriorly. It also allows you to evaluate the position of the maxilla and the mandible as well. This analysis provides a tremendous amount of information that will help you develop the very best treatment plan for your patient. Let's take a look at the conclusion of this video series on the SASSOUNI Plus analysis. The dental alveolar compensation, or DAC, helps to determine the dental bite in the anterior region. It's found by measuring along the long axis of the upper incisor from the incisal edge to the intersection of the palatal plane. The distance should be about 32.5 millimeters. If it's less than that, then the tooth can be extruded to close the bite if needed. If it's longer than that, then it's over-erupted and may need to be intruded if possible. In this case, it measures right at 32 millimeters, so it's in a normal position. You would not want to extrude it or intrude it to change the dental bite. On this x-ray, the measurement is low at 28 millimeters. We draw an arc where the teeth should be so you can see how deficient or extruded the teeth actually are. If this patient had an anterior open bite, you could be fairly secure knowing that you could use an anterior vertical elastics to extrude the anteriors about 4 millimeters to close down the bite. This is a very helpful case finishing tool. In this case, the measurement is long at 36 millimeters. The anteriors are extruded, so you would not want to extrude them anymore. You may even want to try and intrude them in a deep bite case. If this patient had an anterior open bite, then you would not want to use anterior elastics to close down the bite. You may need to tip the maxilla down instead. Next, I'm going to show you how SASSOUNI Plus evaluates the maxilla and the mandible. Let's take a look. SASSOUNI Plus is a unique and effective analysis for many reasons, but one of its big advantages is the way that it evaluates the maxilla and the mandible. It can help you determine the length anteriorly and posteriorly, and the position as well. All of these are looked at independently to give you a true picture of the maxilla and the mandible. To start evaluating the maxilla, let's look at the effective length of the premaxilla. For this analysis, the premaxilla is defined as the distance from ANS to the intersection of the upper incisor along the palatal plane. This distance should be 12 to 15 millimeters. In this case, it measures 17 millimeters, so the maxilla is long anteriorly. This x-ray shows the length of the premaxilla to be 13 millimeters, so it's a normal length in the anterior region. If you need arch length to uncrowd the arch, you would not be able to develop the premaxilla forward. Expansion or distalization may be needed. If this patient was class 3, you may need to use a face mask to bring the entire maxilla forward. The premaxilla could not be developed to correct the class 3 since it's already a normal length. In this case, the length of the premaxilla is 4 millimeters, so it's short anteriorly. You usually see this scenario in a class 3 case. An anterior drive sagittal could be used to develop the premaxilla forward. This would create arch length to uncrowd the teeth and move A point forward. As A point moved forward, the relationship would also move towards a class 1. Now that you know the length of the maxilla anteriorly, we will look at how to determine the position of the maxilla. To determine the position of the maxilla, we look at how a corrected ANS compares to the anterior arc and how the posterior nasal spine compares to the cribriform perpendicular. The corrected ANS should fall on the anterior arc, or PNS should be on the cribriform perpendicular for the maxilla to be considered in a normal position. We start by finding the corrected position of ANS. We just figured out the length of the premaxilla, so we use that measurement to determine the corrected position of A and S. If the length of the premaxilla is short, then you need to extend A and S until it measures about 13 millimeters. If it's long, then reduce the length until it's about 13 millimeters. In this case, the length of the premaxilla is 17 millimeters. So A and S will need to be adjusted 4 millimeters to here to make it the length normal in the anterior region. Now that you know where A and S should be, slide the entire maxilla until A and S is on the anterior arc. In this case, you had to bring the maxilla forward, so you would consider the maxilla to be posteriorly positioned. In a Class 3 case, the maxilla could be moved forward with a reverse face mask to achieve this movement. In this situation, we start by evaluating the A and S. The length of the premaxilla is normal at 13 millimeters, so we don't need to adjust it. A and S is beyond the anterior arc. We want to move it until it's on the arc. To do this, we would need to move it posteriorly, and this makes the actual position to be anterior since A and S is beyond the anterior arc. This is not very common, but it does happen. Orthodontically, it's difficult to move the maxilla posteriorly, and it's very rare for such a movement to be needed. Looking at this X-ray, you can see the length of the premaxilla is 10 millimeters, and A and S is behind the anterior arc a couple of millimeters. When you extend A and S 2 millimeters to a normal length, the corrected A and S falls on the anterior arc. This means that the maxilla is in a normal position. The premaxilla can be developed forward, but the entire maxilla does not need to be pulled forward. Now that we know the position of the maxilla and the length of the premaxilla, we can determine the posterior length of the maxilla and complete our overall evaluation of the maxilla. The last step involved with the maxilla is to determine the length posteriorly. Once you have found the corrected position of A and S and moved A and S so it's on the anterior arc, you will then look at how P and S relates to the cribiform perpendicular. If P and S is on the line, then the maxilla is a normal length posteriorly. If it's in front of the line, it's short posteriorly, and if it's beyond the line, it's long posteriorly. Regardless of the length, there is nothing that you can do to change it orthodontically. In this case, the maxilla is a normal length anteriorly because it measures 13 millimeters. P and S is beyond the cribiform perpendicular by about 5 millimeters, so you would consider this maxilla to be long posteriorly. Looking at this X-ray, you can see that the length of the premaxilla is normal at 12 millimeters. The distance from A and S to the anterior arc is about 4 millimeters. P and S is about 4 millimeters beyond the cribiform perpendicular. The entire maxilla is posteriorly positioned. When you bring it forward into a normal position, P and S should be right on the cribiform perpendicular. P and S and A and S are equal distances away from their reference points, so the maxilla is a normal length, but it's posteriorly positioned. In this case, the length of the premaxilla is normal at about 13 millimeters. The entire maxilla is posteriorly positioned, and A and S is about 6 millimeters from the anterior arc, and P and S is about 4 millimeters from the cribiform perpendicular. Since the premaxilla is a normal length, you need to move it forward to a normal position in your mind's eye. When you do this, P and S will be ahead of the cribiform perpendicular by about 2 millimeters, so you would consider it short posteriorly. There's nothing you can do to change its length, but it helps you understand where the deficiencies are in the maxilla. This concludes the evaluation of the maxilla. Let's take a look at the mandible. The mandible is evaluated much the same way as the maxilla, except the mandible has a growth factor involved and a variance of the chin to evaluate. Some people have a larger or smaller chin button than others, and this can affect the way we answer the questions. SASSOUNI Plus has a way to normalize the chin so the mandible can be evaluated correctly. In order to do this, we draw a perpendicular line from B point to the mandibular plane. We then measure the distance from pogonion to this line. The distance should be 6 to 9 millimeters for a normal chin. If it's not, we will adjust the position of pogonion to compensate for the abnormal chin button. In this case, the measurement is 3 millimeters, so the mandible would be considered short anteriorly. Orthodontically, we cannot do much to change this measurement, but it helps us to determine if the mandible needs to come forward and by how much in a Class 2 case, or the size of the mandible in a Class 3 case. This X-ray really shows how the chin button can vary in size from patient to patient. The measurement for pogonion is 10 millimeters, so it's considered long anteriorly. The tracing shows the oddly shaped chin, and the measurement lets you know that it's long. In a Class 3 case, this measurement may show that you have a long mandible instead of a deficient maxilla. It may make the case more difficult to correct, and it may not be as stable since you will not be treating the arch that is causing the problem. Here you can see the measurement is 7 millimeters and falls within the range of normality. Any problems with the mandible may be caused by its position, but not by its length anteriorly. The next step is to evaluate the position of the mandible. Let's take a look. To determine the position of the mandible, we compare constructed gonion to the posterior arc and pogonion to the anterior arc. At age 12, constructed gonion should be on the posterior arc and pogonion should be on the anterior arc. This question is age sensitive. At age 4, constructed gonion will be ahead of the posterior arc by 6 millimeters, and each year gonion will grow back 3/4 of a millimeter. So we need to compensate for this growth factor. In this case, the mandible is a normal length anteriorly because it measures 7 millimeters. Pogonion is on the anterior arc, so it's in a normal position. Constructed gonion is 4 millimeters in front of the posterior arc. If the patient were 12 years old, it should be on the posterior arc. Looking at this X-ray, you'll notice that the mandible is a normal length anteriorly because the length of pogonion is 9 millimeters, but it is well behind the anterior arc. Constructed gonion is also behind the posterior arc. In your mind's eye, you'll need to bring the mandible forward until pogonion is on the anterior arc. You can clearly see that the mandible is posteriorly positioned. No matter what the age of the patient is, the mandible needs to be brought forward. This is very characteristic of a Class 2 case. By bringing the mandible forward, you can correct the Class 2 relationship and put it into a normal position. On this X-ray, you can see that the length of pogonion is 5 millimeters, so it's short anteriorly. Pogonion needs to be extended a couple of millimeters to make it a normal length. Pogonion is already beyond the anterior arc before you even extend pogonion, so this makes the mandible anteriorly positioned. There is nothing you can do to the mandible to move it back, so you have to treat the case to that position. If this was a Class 3 case, the maxilla could be advanced to compensate for the position of the mandible. You would also need to check the growth direction in this case to make sure that the mandible is not going to grow longer over time. These types of cases can be very difficult to treat. The last question we're going to discuss is the mandibular position and length posteriorly. Let's take a look. The last question deals with the length of the mandible posteriorly and anteriorly. I already discussed how to determine the anterior length when we discussed the length of pogonion. We're now going to look at the posterior portion of the mandible to determine its length. The reference point we'll use for the posterior portion of the mandible is constructed gonion. At age 12, it should be on the posterior arc. At age 4, it will be 6 millimeters in front of the arc and grow distally 3/4 of a millimeter every year until it's about 6 millimeters beyond the arc for males and 4 millimeters beyond the arc for females. In this case, the length of pagonion is normal at 7 millimeters. The position is normal because pagonion is on the anterior arc. If this patient was 12 years old, the mandible would be short posteriorly because gonion is in front of the arc. Gonion is about 4 millimeters in front of the arc, so it would be a normal length if the patient were about 8 years old. Let's assume this patient is about 11 years old. We can see that the length of pagonion is short by about 2 millimeters. When you bring the mandible forward in your mind's eye so the adjusted pagonion is in a normal position, gonion will fall in front of the posterior arc. This makes the mandible short anteriorly, posteriorly positioned, and a normal length posteriorly. If the patient was 15, then it would be short posteriorly. If the patient was 8, it would be long posteriorly. In this case, constructed gonion is well past the posterior arc. The length of pagonion is long anteriorly, and it's behind the anterior arc. If you reduce its length, it will be even more deficient anteriorly. The mandible is considered posteriorly positioned. When you bring the mandible forward so it's in a normal position anteriorly, gonion will still be well past the posterior arc, no matter what the patient's age. This mandible is long posteriorly. This patient has a very large mandible, and these types of cases are very susceptible to TMJ problems. There's nothing that can be done to change the length of the mandible orthodontically, but this analysis can help you understand if a mandibular problem is caused by its position or its length. This will help you treatment plan the case and let you know ahead of time if you are limited in the results that you can obtain.
Thank you for watching this video series on the SASSOUNI Plus analysis. Dr. Richard Beisel is the one who worked on this analysis the most and developed it into the version that I've discussed in this video. His version of SASSOUNI Plus is the best analysis available, and it will help you develop your treatment plans better than any other analysis is able to do. I'd like to thank him for all his hard work, guidance, and teachings over the years. If you would like to learn how to actually do the tracings, there are a number of courses that are available. Dr. Jay Gerber's Orthodontic Studies program teaches this version of SASSOUNI Plus extensively in all of his courses. You can contact his organization directly for more information. We also have a home study course given by Dr. Beisel that's available. You can purchase it from us, and if you mention this video, we'll give you an extra $25 off the purchase price. Just give us a call to order your copy. If you do not want to trace your own x-rays, we do have a service that will do it for you. We can hand trace the x-ray and complete the analysis sheet for you, or we can provide a computerized tracing and analysis. Dr. Beisel prefers the hand tracing, and we're one of the few laboratories in the country that offer this service. In addition to tracing your x-rays, we can provide display models for your cases. Our complete orthodontic records package is one of our most popular services. It includes a set of acrylic finished display models, a cephalometric tracing and analysis of your choice, including SASSOUNI Plus, a model analysis, and this all comes in a patient folder. If you'd like more information about our records service, check out our website or just give us a call. In order to send us an x-ray for us to trace, you can email it to us or just send it through regular mail. You can send film x-rays, digital x-rays printed on paper, or just email the x-ray to us. If you want the x-ray traced and the completed analysis sheet, we do have a 24-hour service. Email us the x-ray and we'll trace it and email it back to you within 24 hours. There's no additional cost for this service, just mention in the email that you want a 24-hour tracing. If you have any questions about SASSOUNI Plus or orthodontics in general, please feel free to give me a call directly. I'd be happy to answer any questions that you may have. Be sure to check out our website for future videos like these, or subscribe to our YouTube channel so you can be notified whenever we release a new video. Thanks again for watching, and I hope the information in this video was helpful for you, and that you will consider using our orthodontic records package on future cases.